Hey, what's up family? Welcome back to Intuition. In today's video, we're going to be answering some pharmacy/medical questions about pain. All right, so let's dive into it. Question number one. Question number one says, opioids are not typically recommended as first-line drug treatments for pain. This implies that opioids are best utilized for treating more specific types of pain. Which of the following would best characterize such a type of pain? So when it comes to treatment of pain, a lot of times opioids are not going to be first-line drugs. And a lot of people would think, well, that's because opioids are Schedule II drugs, which means that they have a high potential for drug abuse and addiction. But there are also physiological reasons as to why opioids might not always be the best choice for treating pain. So before we answer this question, let me go ahead and tell you that opioids are best utilized for treating non-localized visceral pain. And the reason for that is that opioids are able to act throughout the entire nervous system, which means that they're able to block pain signals along the spinal cord as well as in the brain. So opioids are going to be best utilized if pain is coming from a variety of different areas. So when we look at these answer choices, we want to look for diffuse visceral pain, which means non-localized visceral pain. So let's go through the answer choices to see which type of pain would best fit that criteria. Answer choice A says fast, sharp, localized pain. This type of pain is going to be more acute and temporary. Treating the patient with an opioid for a localized type of pain is going to be doing a little bit too much, right? Because you don't need something as strong as an opioid to treat a localized type of pain. Answer choice B says ischemic pain. All right, this right here is perfect. This type of pain would definitely warrant the utilization of an opioid. And for those of you who know your heart attack guideline, you remember the acronym MONA, where the M stands for morphine. And the reason for the opioid in this case is that this is a diffuse visceral type of pain. It's visceral because it's coming from an internal organ, the heart. And it's diffuse because during ischemia, the entire organ is under stress because oxygen is being limited throughout the entire organ. And when the entire organ is in trouble, pain signals will be sent from everywhere within that organ. And remember, opioids are very good at blocking pain signals throughout the entire nervous system. So opioids would definitely be the best option for ischemic pain. And this would be the right answer. All right, let's go on to question number two. Question number two says, a patient with a fever and lower back pain is diagnosed with pyelonephritis. His lower back pain can be characterized by which of the following terms? Select all that apply. Okay, so here we have a patient who came in with a fever and back pain, and he was diagnosed with pyelonephritis. Pyelonephritis is typically caused by a bacterial infection of the kidneys. And this is why the patient feels pain in his back. And the type of back pain that is caused by pyelonephritis is known as flank pain, right? So right off the bat, we can pick that as the right answer, which is answer choice C, flank pain. Answer choice A says muscle pain. Is that correct? The kidneys are not a muscle. The kidneys are internal organs. So this will be visceral pain because the pain is coming from the kidneys. It's going to be visceral pain, and answer choice D would be correct, but not answer choice A. Now, what about answer choice B, referred pain? This one is a little bit tricky, but this one will also be a correct answer. Because referred pain is when pain is caused by a certain source, but that pain is felt in a different area. So in this case, the pain is being caused by the kidneys. Yet, the patient feels as though he has back pain. He feels like his back muscles are aching. So this is what is called referred pain. All right, so the correct answers will be answer choice B, referred pain, answer choice C, flank pain, and answer choice D, visceral pain. All right, let's move on to question number three. All right, question number three says, a pharmacist gives a patient a flu shot and recommends that the patient moves and rubs the sore muscle to help alleviate pain. Is this sound advice? And why or why not? Okay, so you give a patient a flu shot, usually that's going to be in the deltoid and the shoulders. And when you stick a needle into a patient, that's definitely going to damage some tissues and lead to some pain in that area. So that area is going to be a sore spot for a day or two after giving a shot. And in this case, the pharmacist tells the patient to rub the shoulder, move it around, and that should help alleviate the pain in that area. Is that really true? The answer is yes, that actually is true. But the question is why? Remember, on this channel, we don't just focus on what's true and what's not true. We also want to know why. The true crux of learning is in the explanations, right? So that's what we want to focus on. We want to focus on the explanation. Now, why is it when you rub a sore spot, it helps to get rid of the pain in that area? When you rub that area, you create tactile sensations, which is the sensation of touching. Those sensations send signals along the nervous system to the brain. When those sensation signals travel along the nervous system, they help to suppress the pain signals that are also traveling from that area. because it's almost like signal overload, because that's already a painful spot, which means that pain signals are traveling from that area. And then when you touch that spot, then sensational signals will also be traveling from that area. So that's going to be a lot of signaling coming from one spot. So what happens is that when you touch that spot, the pain signals get diluted so that the sensational tactile signals can travel. So rubbing a sore spot definitely helps to alleviate pain in that area. So that's the answer choice that we're looking for. Therefore, the correct answer would be answer choice D. Yes, the tactile signals from rubbing the sore spot will reduce the pain signals. That's exactly correct. And that's going to be a better answer choice than answer choice B, which says that movement and rubbing would reduce inflammation by dilating local blood vessels. That's definitely not going to be a correct answer, because dilating blood vessels would actually cause pain. That's what happens during a headache, right? The blood vessels in the brain get dilated. And blood vessel dilation is typically what happens during inflammation, which is a painful condition. So the correct answer would be answer choice D. All right, so there you have it. Let me know if this video was helpful. Let me know if you learned something from this video. If it was, go ahead and give it a like. Go ahead and leave a comment in the comment section, and continue to look out for our videos every week. And as always, I look forward to seeing you guys in the next one. All right, bye-bye.